matter to your health. The Crooze Doctor on 91.2 Crooze FM. Great music.
Great music.
Great friends.
Great friends.
A very good evening. Welcome to yet another edition of the Crooze Doctor. And I'm your host, Mr. Woods. And of course, in studio, I've got Dr. Amon Mwesigwa. He's a dentist. And of course, he's here to discuss important matters. And like we said with the topic, we're discussing, you call it dentistry? Can I say dentistry?
Yeah, definitely.
Okay, great. Well, so importantly for us to understand, discussing our teeth, to be precise in this regard, there is a current shift for those that have definitely experienced it or possibly are aware that there's a shift right about now as we speak from, just treating pain to having a perfect smile and basically talking about looks, outlook, beauty in this. Doctor, am I right on this?
Yeah, extremely right.
Okay, great. So, the best person in studio, of course, is the health expert himself, the dental care specialist, and I'm talking about the gentleman that can guarantee both the perfect smile as well as relief of pain. Dr. Amon Mwesigwa in studio. And of course, today we'll start, because remember the purpose for us in this is to understand what, a dentist is and what a dentist does. Of course, dental care and going beyond just the dental treatment, and just like I shared in my opening remarks on this. So to start with, Dr. Amon Mwesigwa will want to understand from you as the dental expert, who is a dentist? And feel free to actually shortwave where necessary to explain for my grandma deep in Isinjiro or somewhere in Ibanda so that they can just understand, in their local dialect where some technical language might be used. Go ahead.
Yeah, thank you very much. And thank you, Mr. Woods and the entire Crooze family for thinking about health and above all, thinking about the mouth and the dentists and the oral health in general. So I appreciate you for that.
Thank you.
I'm from Barara, based in Barara, practicing in Barara, from Brighter Smiles family. So, who is a dentist?
Yes.
A dentist, most people do not understand that a dentist is a profession. That's number one. They think we are about removing teeth. And that's why whenever they run around, and in this local family of ours, most people say which is totally a misconception. Dentistry moves from removing teeth. Actually, we do more of treating conditions or diseases that start from the mouth. And we know that the mouth is the mirror of the entire body.
True.
What comes in your mouth defines how your body will be, how healthy you will be. So we are trained in a way that we focus on all conditions that begin from the mouth. And when we talk about the mouth has teeth, it has the tongue, it has the gums. Yeah, it goes even to some level like reaching the throat. But that part of the throat is now another profession called ENT. We look at the lips. So our purpose is to make sure that we do a smile makeover. That's what I would call it. Like we make sure that you smile, you express yourself well, you be in people, you interact with people freely. So that's what a dentist does. And actually for other specialized care, like people who get accidents, maybe a tooth gets out or you get knocked and something happens on the mouth, the lips are torn. Somehow, somewhere, that's where we come in. I've seen people here who fight and you find someone's lip has been bitten off. So we are supposed to put it back and then replace. So that's all what a dentist does. So, but the community knows if I am a dentist going to a dentist, I'm going to remove a tooth. That's the most painful experience I get.
True.
Especially when I've prepared myself, I'm all set to provide care to people, and then someone comes and says, I want to remove a tooth. So people need to change from that perception of going to remove a tooth. And also, if you go in the community and you have this person who has been offering you treatment, and the only sort of treatment when you come they are talking about removing a tooth, that person is not a dentist. I would tell you that openly.
What if you had gone to to school and graduate as a dentist? Then what does it become?
Yeah, you become a dentist, but at school you are not taught to only remove teeth, to be honest with you.
It's just one of the components.
It's one of the, I think I run a private setup.
Okay.
Out of the around 150 patients I see in a month, I can able tell you if I'm removing teeth. They are around 10, and out of the 10, around 5 are kids who are shedding teeth.
Yeah.
And the other 5, probably their teeth are totally broken off. You can't repair it. And so it tells you that we shouldn't. But the people I get with dental pain coming, they are quite many. So that means we are doing more of the saving than
extracting
teeth.
Okay.
Exactly.
So, doctor, then that brings me to my next question. That then, if it's just not only extraction or removing of teeth, then what are the other services? I mean, I know, of course, you try to hint on them, maybe repair here, repair there, because some people will need to know, okay, if doctor says he does more than just, remove our teeth, maybe some people don't even want to remove the teeth, but they want to improve their smile and all those things. I would just want to know, what are some of those services, maybe
to begin with, first of all, we do oral checkups or dental checkups. In the local language, okuchebera mino. Buli muntu ayine kuba nachebeza mino emirundi ebiri omu mwaka. Like everybody should be going for dental checkups twice a year.
Twice a year.
That's the standard. Some people who have chronic disease, like people who are diabetic, hypertensive, those special cases, or people who have mental disorders, they should do checkups more often than the rest of the people. So that means those ones you can push to 3 months, 2 months, sometimes 4, depending on how you find the person. So that's one service, checkup.
Okay.
The other service that we do is we do oral health education.
Oral health
education. Now, this, we after checking you, looking at how your teeth look, depending on how they are positioned, we now predict, like, you're likely to get this condition.
Okay.
And then we are supposed to teach you about probably the diet that you should feed on, the care you should give, how you should brush, how you should floss, how you should clean your tongue, so we can look at your teeth and predict the would-be conditions that you are likely to get, so that when it comes, you do not have to feel surprised, or we can prevent it from what? From occurring. So health education and promotion is giving you that capacity as a person to take care of your oral health, to know that I would be going for checkup every twice a year. That's number one.
Yeah.
Number two, I have a sick tooth that needs to be probably filled or cemented. I need cleaning of teeth. That's also one of the services that we provide. Now, cleaning teeth is not whitening teeth.
Okay, so what is it then?
Yeah, I usually tell people, we look at different people. Like, you are in a group of people, your youth, this one is color, the teeth are totally white.
Yeah.
And now, color of teeth is sometimes determined by race.
By race?
Yes, race. Yeah. Now, you are in people, you find the gum is dark. The moment someone has a gum which is dark,
he shouldn't have very white teeth.
Yeah, the teeth are not actually white, but because of the color of the gum, it tends to bring out the teeth color as pure white, because there is already that black background.
To blend.
Yes, that's art.
To enhance the outlook.
Yes, it makes them brighter, because if the surrounding environment is a little dark, expect what comes out to be extremely what?
White.
Yeah, you said that, and someone, I have remembered a tweet, I think it was Twitter or TikTok, where they showed the first lady smiling in a car. And then they were like, at her age,
her teeth.
Look at how bright her teeth are.
Yeah.
And basically that could be race of, and once you have skin color, if you go to Sudanese, you would think they have purely white teeth. But it may not be white, because
it's just the art.
It's just the art.
God's design.
So when we talk about now, that's cleaning. Cleaning is, we don't change the color of teeth. but we keep your teeth in the natural color, but when they are clean.
And usually, what would you be cleaning them of? You know, for someone to understand.
Yeah, whenever we eat food, because of poor oral hygiene, food gets stuck. Now, if you don't brush your teeth regularly, there is what we call mineralization and remineralization.
Okay.
The longer the food stays in the mouth, we have normal flora, which is bacteria, which eats on the food.
Yeah.
Now, once it's on the food, the byproduct of that is acid. Now, the longer the acid stays in the mouth, the easier the chances of the tooth getting demineralized. It means the acid would weaken the tooth, and then the tooth starts releasing minerals to the food which you have eaten, which is in the mouth, and then the food hardens because it is getting minerals from the tooth, and you get that coating around the tooth.
Yeah.
And sometimes when it stays, you may even brush it and it is not able to come off.
Almost looks like cement, like it's part of the teeth, and yet it's not pleasant to look at.
Yeah, usually after some time, because of diet and the lifestyle, it tends to adopt the color based on the food that you're exposed to. Yeah, so you find people are usually taking greens, you will find that coating which is more greenish. So that coating, once it gets there, we are able to clean it and have your teeth polished, and then the mineralization process continues to take place. So now mineralization occurs like when you brush, the tooth picks directly minerals from the toothpaste. Okay. And they get absorbed. That's why they say toothpaste enhances tooth strengthening. Okay. So that's the mechanism. So once we do that, then so that's what they call cleaning. We are removing what should not be in the mouth. Yes. We are not changing the color of what? Of teeth. Okay. I love that. And well, I'm actually about to even pose a big question here to challenge everybody listening to the show right now, to Dr. Amon Mwesigwa. And I want to ask the question, when did you last visit a dentist? When did you last visit a dentist? Think about it. And the fact that you even said, where we have people with mental illness, they need to be taken to doctor. So that means if the person is not, can't ably take themselves to a doctor, and then family can support, or a friend, can help, reach a dentist so these individuals can have a check. I posed that question there for everybody out there. I'm guilty of not seeing a doctor twice. And now that you've spoken about it, I feel so embarrassed that I was only waiting to have pain, and then I come running to the dentist to try and extract that. But yet, I also acknowledge that I need to have a beautiful smile, and all that. That's really very important. One thing I should just tell you is when we talk about these people are not able to clean their mouth, like the mentally disturbed, we may not clean their mouth. But when you bring this person to a dentist, we may give you a product, be it a mouthwash, we advise related to diet, because even some of the dental conditions they get, they are associated with the medication they are taking for the mental condition. It's like when someone has been on radiations for cancer, chemotherapy. Some pregnant women, when they are pregnant, the medicine they take, it sometimes tends to weaken their teeth. So when you come for checkup, it means we would likely blend in a product that is likely to strengthen your teeth, give you that protective measure, so that the medicine you're taking does not affect the teeth. Okay. I just want to remind our people where we are right now. Of course, we're talking dental health and the shift from just, going for tooth extraction or tooth removal to, of course, enhancing your appearance, your smile. And I have the expert himself, Dr. Amon Mwesigwa. We'll just have a quick reminder of where you're at right now. Of course, on Crooze FM, you're listening to the Crooze Doctor, and be a part of this. We'll take your phone calls on 0752-912-912 and 0780-912-910 in minutes.
It's the biggest medical experts here to talk about the issues that matter to your health. The Crooze Doctor on 91.2 Crooze FM. Great music. Great music. Great friends. Great friends.
The shift from pain to enhancing appearance. And we have the dentist, of course, himself the expert, and I'm talking about Dr. Amon Mwesigo in studio with us. And of course, we're discussing enhancing your appearance beyond just going to dentist to relieve you of pain of your dental situation. So, doctor, returning back to discussing the issue at hand, of course, the shift from pain to enhancing appearance. You just dropped off on the note where you were talking about how we can help those with mental conditions, for the different reasons that could weaken their teeth, maybe because they're on chemotherapy or any form of treatment for the pregnant women that would weaken their teeth. But I love the fact that you mentioned that there's always help, because some of these would think it's a reason good enough to stay away from the doctor. But the doctors know exactly what to do, and I would encourage them to come over. But let's shift, doctor, to the question, shifting from pain to appearance.
Yes.
So if that is the new trend, what is this all about? The shift from pain to appearance. Because I know myself, I used to be one of those people. I once had a tooth extracted, and I ran to doctor with my crying, holding the cheek that had the problem tooth. But now, talking enhancement, the shift from pain to appearance. Go ahead.
Thank you very much. Now, when we talk about dental pain, most people have taken wrong decisions in the mouth because of pain.
Yeah. And how is that?
Yeah, you have taken wrong choices because of pain. One, you get a condition, you keep it silent. Then when the pain is too much, when you come to the clinic, you are thinking about only having this tooth out of your mouth.
Yeah.
That is one of the things that is causing pain. Then the other thing that has been happening is someone thinking, when I go to the clinic, the whole process of working on me, treating me is going to be extremely painful. So those are two concepts that have been really disturbing people.
Yes.
So you find most people fear going to the dentist because they expect I'm going to go through a painful process. Yeah, then also has been the issue of dentistry as a profession, where some colleagues would be a bit rough. Like you take your child, you're taking the child, this child is already fearing, and then the child is what? So we have looked at all those now. Pain, we are saying you can come with the pain. We can offer treatment. You keep with your tooth.
Yes.
And we take away the pain. So you no longer take it. Just imagine you are coming. The tooth which is thick is the front tooth. You have now these front teeth which you need for smiling, and actually most people have had the front teeth getting sick. They have been fearing to go for treatment because they think if I go, the doctor is going to remove it.
And change the looks.
Yes. So now what we are doing is we have a new technology which is maybe like this thing, if you have heard of things like root canal therapy.
Yes.
So we just treat the tooth. It's like an operation. You go, cut the tooth off all sensitive and blood supply. So the tooth no longer gets that
sensitivity.
Yes, so you can no longer feel pain, but we keep the tooth there, we treat it, then after that we shape it in that the part which was lost, for example, if you had a hole, that part is built again, we seal it where need be. We can even make for you another top crown, like when you see the tooth. We can make the top part and just put it there to shave the tooth and get back to normal shape. So that is now getting away the pain, and now we shift to normal appearance. Then when we have also revised our procedures, how we do the procedures. There are many products that have come on board, like those sprays, the anesthesia which you smear on the skin before you give an injection,
so that you kill pain,
so that the patient does not feel pain in the process of treatment. So you can, even a child can come, you talk to the child properly if they cooperate. You can give an injection, but even when you're going to inject, there's already the pain is, the person is not able to feel pain. So that kind of shift is, we are promoting people. Like we want people to feel like dentistry contributes a big thing on my appearance, on my outlook. So I shouldn't fear a dentist. I should freely go there and I would get the appropriate services.
True.
Yeah, the biggest challenge is most of this profession, you see there are many quacks around.
Yes.
So you go to someone, the moment you go and the only first option someone gives you is removing a tooth, I usually get worried.
Yes.
So that is the shift you're talking about. Then the other thing is, so people need to know that if I have a dental condition, be it painful, be it pain or not pain, it can be managed smoothly and I would recover properly. Though there are those cases at the extreme that an extraction may not be what? Avoided. Now, we are now moving from this pain. Now we are going to good looking.
Yes.
Yeah, dentistry is very unique in a way that it can promote someone or it can put down your esteem.
Yes.
Yeah, if you see most of these youth that have marine teeth, that probably have a bad breath, like the mouth is smelling.
Yes.
There are those things that there are people that would actually want to have their glitters in the mouth.
Yes.
So the other thing that where people feel that now I want to look like this. I know TikTok has come, social media has come, people read things, different things from different forums. So these are not things that people should look at and think these cannot be done anywhere. We have a little improved to be able to meet the needs of the different groups that we have.
Yes.
You know, children would want a specific service, a youth would want this service, the corporates would want this kind of care. So we are trying to blend that so that we meet. Now, for the elderly, when we want to talk about outlook, it means now elderly that have lost teeth, they can have their teeth replaced. Be it temporary or permanent. Yeah, they can have their teeth replaced.
And how do you do that?
You know, that's what it is. That's why it is a unique profession. So if you came, we would measure you, look at the space that you have, then model something that sits there. Then if we think we need to use the neighboring teeth to support that area, we measure there and we have them involved. And within a week or 2 weeks, you already have those teeth artificial you have. So it is not something that we shouldn't be or should be worried of. If you have a gap and you want your teeth replaced, it can be done. If you have teeth that are not in line, we can orient you on maybe braces. People you have heard about, people talk about braces. Yeah, if you are born in an area where originally, because of high fluoride in water, your teeth are brown. We can also have remedy where we cover them and probably they look
whiten them.
Attractive. Not whitening, but we can cover them. Like what we call veneers. People these days, people read. You can talk about veneers, you can talk about something else, but you cover them in a way that the person looks at you and your smile looks very attractive, and even you feel it within yourself that now I can laugh. You know, I have a very good story. When I was at school, we had just reached in dental school, so I didn't know that ladies can hide a lot of things. So there's a very beautiful lady that we had. She was in another group, so every time she would laugh, I would not see her lips go to the gum level.
She used to hide.
She would laugh and of course you'd see she's laughing, but I didn't know. So only now to find that after some time when we had reached in the session where now you go to practicals. And because we had been close, so I was close to her peers, she opened up to me. And she had like 4 teeth, front teeth that were eaten up, and she could not laugh to that level. So the moment we worked on them and replaced and the color became fine, the smile changed immediately. So there are many people out there that would want to express themselves of whichever age groups. There are people are suffering from different dental conditions that are really restricting their expression. Like people not having teeth, like people smelling the mouth, like people having teeth out that are not online. There are all sorts of things. Even the people that probably are smoking, they feel their teeth are stained. All those things can be what? Can be worked on and someone expresses themselves.
Okay. Doctor, there's another question here. I remember you were speaking about people who had, like some preconditions, on, I remember you mentioned something to do with diabetes. So I just want to just get back there because there might be people who have some underlying conditions, and just to ask you what the link between dental neglect and systemic health, and of course talk about maybe heart problems or the diabetes in this. How do you explain that for this person at home that is possibly carrying this kind of condition, and it might also contribute to their dental.
When you talk about diabetes in oral health,
yes,
there are groups like diabetics, there are pregnant mothers.
Yes.
Then when you talk about people with chronic disease, now what happens is most of these conditions that people have, first of all, the immunity lowers when you have such conditions.
Mm-hmm.
Now, once the immunity lowers, even chances of developing gum disease, they are very high.
Okay.
And also, because like if you are looking at someone who is diabetic, their saliva is likely to have more sugars. That's why usually you see people saying, because of salivary sugars, there are high chances that those sugars can be broken down, and we have the acid production in the mouth becomes too much. So they are prone to their teeth getting holes.
Oh.
Yeah, now when you talk about pregnant women, there are some medication they may give them.
Yes.
Be it syrups,
yes,
which might also have that sticky substance, and they are broken down and their teeth starts getting holes. Now, during this period, when someone has diabetes, someone is pregnant, like for pregnancy, there's a lot. It is immunity. It is, if I first deal with the pregnancy, we have immunity, we have hormonal changes. All those create poor oral hygiene in the mouth.
Yes.
And eventually you can get gum disease. And because of the medication, a pregnant person can even get their teeth starting to get holes.
Yeah.
So we are saying during that period when you are in that condition, your oral hygiene should be at the maximum. It's when you should be going for dental checkups, because there are products the dentist can do. Like for example, someone can do cleaning for you when you are pregnant, maybe twice.
Yeah.
Now, if someone did...
Twice a year or twice a month?
During the cycle.
Okay.
The pregnant cycle. You can do cleaning twice.
Women know the cycles.
Yeah, they know. A pregnancy, definitely, even you know it takes 9 months.
Oh, yeah, you're right.
Yeah, so I have not seen someone who goes beyond 9 months. So, although there are some weeks and what, but standard is 9 months. So in the 9 months, you should have done cleaning at least twice a what?
Twice a year.
Yeah.
Twice a month.
Then the other issue is pregnant women. There is that misconception that a pregnant mother cannot be treated. You cannot treat their teeth. You cannot. It is just perception.
Yeah.
The person treating you should know you're pregnant. You're either hypertensive or not hypertensive. They should know the medication they're giving you is safe for you and for the baby you're carrying.
True.
Once that is taken care of, there should be no worry of a pregnant person going for dental care. Because you might keep this tooth when it is paining you out of pregnancy. Yeah. It can kill you. You can get sepsis, and all of a sudden we find you are no more. So now, when we shift to diabetes, hypertension, now that's when you talk about things like even HIV. Now, naturally, these people are surviving on what? On medication.
Yes.
Now, the moment you survive on medication, it means your immunity is fighting, the medicine is fighting. No. Now, research shows that people who are diabetic, when they develop dental diseases, gum disease, or even caries, once they go through that cycle, the medication they are taking for diabetes, control the sugars, may not give them the same effect like someone who is diabetic with a good oral hygiene.
Okay.
My research has been on oral disease and diabetes.
Yes.
And so I'm giving you information. And now I did my study here in Imbara Regional Referral Hospital. So out of the number of people that had diabetes, 72% had teeth with holes.
Whoa.
So you can see the relationship now. It's not very far.
No.
Now around 98% had gum disease. So now you can see there is a very big Now, this is
Coloration.
compared with the same age group without the diabetes.
With the condition.
Yeah, without the
Underlying
condition. So once you look at the underlying condition,
Yeah.
they weaken the immunity, they expose you to different environments, and even because of diet restrictions,
Yes.
you're not likely to get minerals,
Yeah.
mineral content like someone who is not diabetic.
True.
So those restrictions also affect the strengthening of the what? Of the teeth. And also, and other tissues, let us not just look in the mouth, because you have seen people with the diabetes developing, let's say, infections in the gums.
Yes.
And when these infections come in someone whose immunity is already low, it is what? It is inflammation.
Okay, so doctor, in 1 minute, I just want you, for the much that you've spoken about, I want you to just point out some of those indicators, those symptoms, because there are people wondering, okay, does my condition qualify me to see a dentist? So if you were to use even 30 seconds, I don't know, because I want to take phone calls, what are just some of those symptoms, for someone out there to reach out to you, and of course you let us know where they can find you. What are some of those symptoms
once
in
you
relation
are,
with their dental health?
Once you or your friends are uncomfortable with your breath in the mouth, you need to see a dentist.
Exactly.
Once you take water, hot or cold, and you feel sensitivity, you need to see a dentist. Once you put your brush in the mouth and you spit blood, the sign that you should see a dentist. Any form of pain, either in the mouth or radiating in the ears or even going to the eyes, the dentist should be there.
Yes.
Any kind of discomfort that you get in the mouth should be a dentist. Any wound that you get in the mouth that stays for more than a week or 2 weeks when you have taken any kind of medication, you're supposed to see a dentist. And any person, sick or not sick, after every 6 months, you should see a dentist.
And how about somebody, I remember somebody who said, I have a very bitter tongue. And I was like, well, bitter tongue? What's that? So should those come to you as well?
Yeah, all those. Anything in the mouth should begin from what you're just asking.
Yes.
We have had people who get conditions on the tongue, conditions in the lips, conditions just on the gum, even a small swelling on the face.
Yes.
And then they keep in clinics rotating. The clinicians do not understand what this condition is.
Yes.
Once they come to the dentist, we are able to identify it. Because for us, we deal with the face and the mouth.
Beautiful. The face and the mouth. We have Dr. Amon Mwesigwa in studio with Mr. Woods, and he's, of course, the Crooze doctor. We're going to take phone calls right about now. And, of course, you can watch us on Crooze TV. That's, of course, on TikTok. That's Crooze TV. And on YouTube as well. We're live on YouTube. That's Crooze TV. And, of course, you can also send us messages on X. That's at 912 Crooze FM. Verified page it is. And Facebook, 91.2 Crooze FM. Verified page as well. So we're going to take phone calls, but just shortly after this brief break. Dr. Amon Mwesigwa, the dentist expert in studio for the Crooze doctor.
Celebrate, make it.
Crooze Doctor on 91.2 Crooze FM. Great music.
Great music.
Great friends.
Great friends.
Welcome back. We have only 2 minutes and we're going to take calls. And you need to keep your question really short and go straight to the point so doctor can respond. He only has got a minute. Crooze Doctor, good evening. Yes, go ahead. Your name? Okay, go ahead. What's your question for doctor?
So my question to the doctor is that what causes the yellow color of
Okay, what causes the yellow color, I believe, of the teeth? Okay, next question. Crooze Doctor.
Yes, Mr. Wood and the dentist. Good evening.
Good evening. Give us your name and your question.
You're talking with Mr. Noah and Bruce Mondra from Korata Jimbigara.
Thank you. Go ahead.
Now it is like an inquiry. I wanted to inquire from a dentist whereby there is this first aid whereby they say when the tooth is really paining and you apply salt,
Yes.
it can really reduce the pain. Is that one advisable or?
Okay. Well, the application of salt, if it, to relieve pain. He wants to know. Crooze Doctor.
Yes, Mr. Wood.
Yes, good evening. Your name and question. Go ahead. What's your question?
My question is,
My
young brother has a teeth that is that brown reddish coat.
Okay.
I don't know whether they can clean it and become.
And it whitens or something. Okay. Well, brown reddish coat on the teeth.
Okay.
So I think we'll take this. Doctor, you can go ahead.
Okay. The person who asked about the yellow color of teeth, sometimes it could be fluorosis. Fluorosis is when a tooth gets too much fluoride, and this is a common condition in people who live below the mountainous areas because their water bodies, the water from the hills, come with too much fluoride.
Okay.
And when people take it, their teeth tend to absorb much of it, and they be brown.
Okay.
So I assume that it is not that, because some people also, because of that, your teeth can be brown because of what you eat on. So the best for that person, the best option is to come to a dentist, check up so that we know the cause and give a solution. Salt in pain management, avoid salt.
Why?
That's what I would say.
In brief.
Yeah, salt it would not really take away the pain. Instead, it can, if you put normal salt on a wound, it can tear the wound. That's number one. And this could be it can lead to early cancer. It could be one of the leading causes. How we use salt is we mix water with salt, and then we use it as a rinse, like something to clean the mouth, not to take away the pain.
Okay.
There is no pain mechanism in salt.
Okay.
Then
Quick
people
one.
with brown reddish coating, that one can come for scaling and polishing, and they will be off.
Okay. There's a quick question from Nelson Agaba, and he says, Dr. Amman, I would like you to highlight me on teeth alignment in just 30 seconds.
Teeth alignment, it is something that we do. Now, because of genetics, some people, you find you can have a small jaw and you take your parents' size of teeth. So chances are high that your teeth may not fit in the mouth when they come. And also because of sometimes some people may not take their children for early removal of primary teeth.
Okay.
And so the primary and the secondary can come in the same time. You find you have all the teeth in the mouth. And so when teeth grow and you find they are not online,
yes,
we have what we do braces.
Okay.
Braces is we align the entire jaw so that the teeth can fit in. Sometimes some people may remove some teeth to accommodate others. Others may not have the teeth to be removed. So braces, it is something that has to be discussed between you and the dentist, because you have to first do assessment.
Yes.
Once you do assessment, then alignment can be done.
Okay.
Yeah, maybe for other people that would probably want to interact with us, not here,
Yes.
because of time, I would just give them my contact. But I'm from Brighter Smiles Dental Services. We are here at GBK Plaza, Makanising Street, and my contact is 0700726076.
Okay.
So they could find me there, and we can pick it from here.
Okay. I want to remind everybody that a good smile starts with dental care, not just, treatment of pain. And of course, your teeth can grow back, of course, if you visit a dentist, and they can help you on how to, restore both your smile and then, of course, deal with that pain issue. We thank you, Dr. Amon. Thanks so much for being a part of this, and we look forward to hosting you again.
Yeah,
right
you're
here
most
on the Crooze
welcome.
Doctor.
I'm always available. I thank you. This is our first show we've done.
Yes.
I'm looking more and more interactions.
Me too,
Yeah,
Doctor. Yes. So Mr. Wood saying, "Be God bless you," and we've got the hit selector coming up. That's with Dixon. Don't miss out. So many great things like I love to say is going to happen to you, and more great programming right here at Kafuru Wawino. And this is the Crooze Doctor. We come to a close. God bless you. Good night.